In the first section of the series on vaccines, we started with a brief tour through the immune system. We learned about memory cells, macrophage, T cells, and how they work in conjunction to keep their fortress, the body, safe from intruders. We then learned about vaccines and how they mimic an infecting agent in order to create the desired immune response. We examined some vaccine technologies that have been around for a while, as well as learning about new ones. Now that we have that under our belt, let's begin this section with a discussion about which vaccines are considered important and the diseases they prevent. The American Animal Hospital Association's Canine Vaccine Task Force initially met in an effort to establish vaccine guidelines and recommendations. One of the main thrusts of the AHA study was to devise a framework for assisting veterinarians in determining which vaccine should be administered to which patients and why. Thus, vaccines are grouped into categories called core, non-core or optional, and not recommended. According to AHA, core vaccines are those that all healthy dogs should receive in one form or another. Non-core vaccines are optional and should be administered selectively based on geography and lifestyle or exposure risks. Vaccines that fall in the not recommended category are due to the lack of demonstrated efficacy or indication of unacceptable risk of side effects. The diseases that dogs are routinely vaccinated against are chosen due to a history of being highly infectious or carry a significant mortality rate. We will discuss the DHLPP-CV, rabies, and Bordetella vaccines. Although the nickname distemper booster is commonly uttered, it can be misleading. This vaccine actually contains many other components. The most common vaccine combination is distemper, hepatitis, lepto, parainfluenza, parvo, and corona. It may also be called by the initials DHLPP or DHLPP-CV. This coding represents the first initial of each component in the vaccine. Thus, a simple set of letters can tell us exactly which diseases an animal has been vaccinated against. Let's begin with the D, which represents distemper. The typical suspects of distemper are rescue or shelter puppies or adults with questionable vaccination history. The virus is spread through contact with an infected dog's bodily secretions. The virus enters the new host through the nose or mouth. Perhaps the most classic and familiar sign of distemper is the thick mucoid discharge running from the eyes and nose. This is due to the virus initially attacking the respiratory system. Fever and pneumonia generally follow. At this point in the disease progression, the central nervous system may become involved, likely leading to convulsions or other neurological symptoms. The classic distemper seizure appears as a dog snapping at something in the air or chewing gum. Dogs that recover from distemper often have persistent nervous disorders for life. AHA has classified this vaccine as core. The second letter in the combination vaccine we are discussing is H. The H represents hepatitis, or infectious canine hepatitis as it is sometimes called. Infectious canine hepatitis is caused by a virus called adenovirus 1 and is spread by either direct contact with an infected animal or by indirect contact in the form of urine or stool. This virus attacks primarily the liver and sometimes the kidneys, resulting in a high fever, extreme lethargy, and loss of appetite. It can be life-threatening, especially in young animals. Sometimes we'll substitute the letters A or A2 for the H. When this is done, the A represents the virus contained in the vaccine, or adenovirus 2. You may wonder why the vaccine contains adenovirus 2 when the cause of hepatitis is adenovirus 1. It has been determined that adenovirus 2 is similar enough to the hepatitis-causing adenovirus 1 virus that it provides cross-protection against both diseases. AHA classifies the adenovirus 2 vaccine as core. The L represents leptospirosis or lepto. This disease is different from the previous ones as it isn't a virus. Lepto is a uniquely shaped organism called a spirochete. Microscopically, it appears to be a curly question mark. The disease is contracted through contact with infected urine, either orally or through damaged skin. The spirochete quickly gains access to the circulatory system, causing joint pain, fever, vomiting, and overall malaise. The final destination of this invader is the renal system. Once it gains a hold over the kidneys, renal failure is likely to follow. Although leptospirosis is not terribly common, it is of significant concern because it is zoonotic, meaning that it can also cause illness in humans. Also of note, the lepto portion of the combination vaccine has been linked to vaccine reactions ranging from facial swelling and hives to acute anaphylaxis. Additionally, the vaccine is believed to offer protection against only a few of the more than 100 species of leptospirosis strains found in the environment. For this reason, AHA has classified this vaccine as non-core, except in those endemic areas for lepto. One of the P's in the combination vaccine represents the virus that causes parainfluenza. The virus primarily affects the respiratory system and is highly contagious in congested areas with poor air circulation such as pet stores and shelters. Transmission is via the oral nasal route, and the main clinical sign in an infected dog is a harsh persistent cough, sometimes referred to as kennel cough. Infection with the parainfluenza virus often leaves the door open for secondary bacterial infections to occur. AHA classifies this vaccine as non-core. Keep in mind that non-core means optional and depends on geographic and lifestyle exposure, thus leaving the decision to vaccinate up to the veterinarian. Parvovirus, the other P in the vaccine, is probably the most commonly seen disease we are discussing in this section. Disease transmission occurs when puppies or immune-compromised dogs ingest infected feces. The parvovirus primarily attacks rapidly dividing cells. Because the cells that line the GI tract are constantly multiplying, the virus targets that lining and literally causes it to slough off. As a result, the intestines are left without their protective internal mucosal lining. Commonly seen signs of disease are vomiting, followed by profuse bloody diarrhea. Because of resultant poor absorption and loss of body fluids, dehydration is a serious concern. If left untreated, the virus has a very high mortality rate. AHA classifies this vaccine as core. AC or CV may or may not be included in the combination vaccine, representing the coronavirus. To simplify our explanation of the coronavirus and its corresponding disease, it often presents a mild version of parvo. Like parvo, it is a disease of puppies or unvaccinated adult dogs. Unlike parvo, it does not typically cause vomiting or bloody diarrhea. The diarrhea is caused by malabsorption rather than a sloughing of the intestinal tract. Coronavirus fortunately has a much lower mortality rate and often goes unnoticed in healthy dogs. AHA classifies this vaccine as not recommended. The report states that prevalence of clinical cases of confirmed CCV disease does not justify vaccination and that clinical disease rarely occurs. When it is seen, it is typically mild and self-limiting. The rabies vaccine is the other major dog booster given. It is commonly abbreviated R or RV for simplicity and consistency. Fortunately, because of the widespread use of the rabies vaccine, the occurrence of rabies has dropped substantially. The virus concentrates in the saliva of an infected animal and thus spreads primarily from a bite wound that breaks the skin. Once the virus has entry into its new host, it migrates up nerves into the spinal cord and eventually ends up in the brain. Once the virus has made its way to the brain, the disease becomes transmissible and signs present. The first stage, the prodromal stage, has been reached when the animal's larynx begins to spasm and a personality change occurs. The excitative stage soon follows, and it typically presents as paralysis of the throat area, causing the inability to swallow. This paralysis tends to be mistaken for a dog that is scared of water or is mad, as evidenced by the foaming at the mouth. The last stage is termed the paralytic or dumb stage. At this point, the affected animal will suffer from general paralysis that leads to death. Specifically, the animal is unable to breathe due to paralysis of the muscles which control breathing. Because of its zoonotic nature, rabies is one of the only vaccines required by law for dogs in most states. Each state or municipality has laws specifying the age at which a puppy must receive its first rabies vaccine and the subsequent boosters. AHA classifies this vaccine as core. The last disease we will discuss that is commonly vaccinated against is infectious tracheobronchitis, or more commonly known as kennel cough. As we previously discussed, the viruses that cause adenovirus 2 and parainfluenza may lead to tracheobronchitis. The most common cause is a bacterium called Bordetella bronchoseptica. Typically, dogs are infected when they are housed in highly populated and often poorly ventilated areas, such as boarding kennels, grooming parlors, and shelters. The resulting cough sounds much worse than it is. In fact, the infection is self-limiting and, in most cases, resolves with or without antibiotic therapy or antitussive medications. The vaccine is available in two forms, injectable or intranasal. AHA classifies this vaccine as non-core or optional. However, many veterinarians routinely vaccinate dogs against Bordetella, as many clinics offer both boarding and grooming services. All of these vaccine components, with the exception of rabies and Bordetella, are commonly incorporated into one injection. Most combination vaccinations require reconstitution or mixing of a powder with a liquid prior to administration. Once the liquid portion or diluent has been added to the dehydrated vaccine and gently agitated, the reconstituted vaccine should be drawn out in an upright fashion. This combination, after being properly mixed, will form approximately 1 cc of injectable vaccine. This standard amount is given to all dogs regardless of age and size. If drawing from a multi-vaccine vial, be careful not to contaminate the vial. Additionally, all vaccines must be kept refrigerated from the point of manufacture to the point of injection. This is always a concern when individuals other than veterinarians administer the vaccines. Keeping companion animals healthy is at the heart of veterinary medicine. While immunization may be among the most common procedures performed in a veterinary hospital, it is a medical decision that should be taken seriously. In the next section of the series on vaccines, we will explore the diseases our feline friends are typically vaccinated against.